to light the way. Making nursing stupid simple every day.
Okay, real talk. You are going to see one of these patients on the NCLEX, and one of them will try to trick you. Hypoglycemia, hyperglycemia. 2 words, 1 letter difference, completely different emergencies. And here is the mistake nursing students make all the time. They mix up the symptoms. They confuse the timing. Or worst, they give the wrong intervention first. On a test, that costs you a question. In real life, it can cost someone their life. So today, we are breaking this down so simply that you will never, ever mix these up again. No textbook walls of text, no boring charts. We're going to understand this the way your brain actually learns, with a story, a comparison, and some NCLEX tips you can use immediately. Think of blood sugar like the gas in your car. Your brain is the engine. It only runs on glucose. That's it. No substitutes. So when glucose drops too low, your brain starts shutting down. When it gets way too high, your blood turns into a thick, sugary swamp, and your body starts screaming for help. Hypoglycemia, hypo means low, blood glucose below 70. This is a fast emergency. Your brain is starving right now. Hyperglycemia, hyper means high, blood glucose over 180. This is a slow burn. It builds up over hours to days. Think of it as a slow leak you ignored too long. Memory trick. Hypo, the body hits the floor. Hyper, the body is on the ceiling. Low is down, which is emergency fast. High is up, which is slow buildup. Now, before I give you the full breakdown, let's watch a scenario that's going to burn this into your brain.
It's 7 a.m. on a busy medical surgical floor, and Nurse B is starting her shift with coffee in one hand and her patient list in the other. First stop, room 204. Mr. Torres has type 1 diabetes and received insulin at 6 a.m. When Nurse B walks in, she notices something right away. Mr. Torres is sitting up, but he looks pale. His hands are trembling, he's sweating, and he seems anxious. He looks at her and says, "I feel weird, kinda shaky. My heart is racing." Nurse B knows these signs matter. Shaky hands, sweating, a fast heartbeat, pale skin, and sudden confusion can all point to hypoglycemia. That means the blood sugar is too low and the brain is not getting the glucose it needs. Then Nurse Oops appears and says, "Don't worry, high blood sugar is the real danger. Let me get the insulin." Stop right there. Never give insulin to a hypoglycemic patient. Insulin lowers blood glucose even more, and that can turn a dangerous situation into a life-threatening one. Nurse B checks Mr. Torres' blood glucose. The meter reads 48 milligrams per deciliter. That is a medical emergency. She acts quickly using the rule of 15. Give 15 grams of fast-acting carbohydrates, wait 15 minutes, then recheck the blood glucose. Mr. Torres drinks orange juice. 15 minutes later, his color improves. His hands stop shaking, and his blood glucose is now 88. Crisis averted. Next, Nurse B heads to room 206 to check on Mrs. Chen, who has type 2 diabetes. Mrs. Chen looks exhausted and is drinking yet another cup of water. She says, "I've been so thirsty. I keep running to the bathroom. I feel like I'm moving through wet concrete." Nurse B recognizes a different problem. This is hyperglycemia. Blood sugar is too high. The classic signs are the 3 Ps. Polyuria, which means lots of urinating, polydipsia, which means lots of drinking, and polyphagia, which means lots of eating. Mrs. Chen's glucose is 340. Unlike hypoglycemia, which can happen fast, hyperglycemia often builds gradually over hours or days. The treatment is different too. Hypoglycemia needs sugar fast. Hyperglycemia may need insulin, fluids, monitoring, and provider notification depending on the situation. The key lesson is simple. Know your patient, know the signs, and choose the right intervention. Low sugar? Give sugar. High sugar? Think insulin, fluids, and follow protocol.
Okay, you saw it. Now let's lock it in. Here are the differences that will actually show up on your NCLEX. Skin is your first clue. Hypoglycemia, cold and clammy. Why? Because adrenaline kicks in when your sugar drops, causing sweating. Hyperglycemia, warm and dry. The body is dehydrated because it's dumping water trying to flush out all that sugar. Memory trick, cold and clammy. Give some candy, hot and dry. Sugar is high. Onset matters so much for priority questions. Hypoglycemia is fast. We're talking minutes before someone seizes or loses consciousness. That's why it's always the higher priority intervention on the NCLEX when you're comparing the two. Common NCLEX trap. The question gives you a diabetic patient with confusion and high blood sugar, but the glucose is only 210. Meanwhile, another patient is shaky and pale with a glucose of 52. Always address the hypoglycemic patient first. Low sugar is faster brain damage. If your hypoglycemic patient cannot swallow, you cannot give juice. That's a choking hazard, and the NCLEX will test you on this. The answer is dextrose 50% IV push, or glucagon IM if there's no IV access. Student mistake: giving oral glucose to an unconscious or unresponsive patient. Never do this. Always check level of consciousness first. Quick advanced note, because the NCLEX loves this. Severe hyperglycemia can lead to two emergencies: DKA in type 1 diabetics and HHS in type 2 diabetics. DKA comes with fruity breath and Kussmaul breathing. HHS has extremely high glucose, sometimes over 600, but no ketones and no fruity breath. Both need fluids first, then insulin. Priority for DKA, HHS. Fluids before insulin, always. The NCLEX will test this. Give normal saline first to rehydrate, then insulin drip. All right, pop quiz time. Pause the video if you need to. Read the question, pick your answer, and let's see if your nursing brain is working today. Question 1. A nurse is caring for a client with type 1 diabetes who received insulin 30 minutes ago. The client is now diaphoretic, pale, and reports feeling shaky. Blood glucose is 54. The client is alert and able to swallow. What is the priority nursing action? A. Administer 50% dextrose IV push. B. Notify the healthcare provider immediately. C. Give 15 grams of fast-acting carbohydrates by mouth. D. Hold the next scheduled insulin dose. Answer: C. The client is conscious and able to swallow, so oral fast-acting carbs come first. D50 IV push is reserved for unconscious or unresponsive patients. Notifying the provider, B, is appropriate after the immediate intervention. Holding insulin, D, addresses the cause but is not the priority right now. Fix the glucose first. Question 2. A nurse assesses a client with type 2 diabetes and notes: blood glucose 480, extreme thirst, frequent urination, and weakness. Respirations are 18 breaths per minute and unlabored. There is no fruity odor to the breath. Which condition does the nurse suspect? A. Diabetic ketoacidosis, DKA. B. Hypoglycemia. C. Hyperosmolar hyperglycemic state, HHS. D. Insulin shock. Answer: C. Type 2 diabetic plus extremely high glucose plus no fruity breath plus no Kussmaul. Breathing is HHS. Question 3. A nurse is preparing to administer insulin to a client in DKA. The most recent potassium level is 3.0. What is the most appropriate nursing action? A. Administer the insulin as prescribed. B. Hold the insulin and notify the provider. C. Double the insulin dose to correct the DKA faster. D. Give oral potassium supplements and proceed with insulin. Answer: B. Insulin drives potassium into cells, which would worsen the existing hypokalemia. Normal range, 3.5 to 5.0. Giving insulin with a potassium of 3.0 risks life-threatening cardiac arrhythmias. Always correct potassium before or alongside insulin in DKA. This is a safety-first NCLEX question. When in doubt, hold and notify. All right, future nurses. So how did you do? If you missed any questions or felt stuck on a topic, don't stress. That's how you learn. Nursing school is all about repetition, practice, and building confidence one step at a time. Don't forget to grab your free cheat sheet linked below to help you review today's lesson. And if you want extra NCLEX-style practice questions, bonus rationales, memory tricks, and extended study sessions, check out my Patreon linked in the description for even more no BS nursing content. Make sure you like, subscribe, and turn on notifications so you never miss another stupid simple lesson. All right, future nurses, you've got this, and I'll see you in the next one.